All right, we'll do our first mic check. 1, 2, 3, 4, 5. And over here for questions. 1, 2, 3, 4, 5. All right, we'll do our final mic check. 1, 2, 3, 4, 5. And over here for questions. 1, 2, 3, 4, 5. We'll get started in just about 5 minutes.
Good Thursday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. Our moment of gratitude today is dedicated to all the groups working diligently to get vaccine into our community. In just over 2 weeks, Kchd has provided vaccinations to nearly 4,000 people. We want to emphasize the significance of that. 4,000 people who are considered high risk because of their age or their profession received this much anticipated protection. This is good news, and it's what we've all been waiting for. And as a reminder, those 4,000 doses are just the ones that we've given here at KCHD. That doesn't include all the ones given by hospitals and other partners in the county and throughout the region. We want to assure you that everyone who wants vaccines will be able to get one, but it will require patience. For the foreseeable future, demand of the vaccine will outpace supply. And while we are encouraged that so many individuals want this vaccine, we urge you to please be patient, as it will take many months for the supply to catch up to the demand. Regarding our vaccination efforts, we will continue scheduled vaccination opportunities as supply allows. This will include the use of multiple strategies, as we've been saying, including large clinics, scheduled appointments, and the use of multiple closed points of dispensing sites or pods to provide vaccinations to our community. As we have said before, qualifying individuals should choose the opportunity that's most conducive to their health and medical situation. Additionally, we are exploring ways to utilize community partners to assist in our vaccination efforts. Moving forward, this will be a more sustainable way to increase vaccination availability throughout the county. The more distribution points for vaccination, the more opportunities folks will have to get the much needed protection. But once again, this is all of this is dependent on the supply that's on hand. We acknowledge the desire to receive this much needed protection and will continue to work as hard as we can to answer questions and provide guidance. To that end, the Knox County IT department is assisting us as we explore ways to expand our phone capacity to the public information line. Additionally, we are looking for ways to offer an online registration, or looking at ways, to offer an online registration platform to schedule vaccination appointments, as opposed to scheduling them over the phone. For those without a computer, there will be phone line that can still assist them. We will have additional details regarding the registration platform as soon as it's available. We'll get it out to you all. We know that there are lots of questions about when it will be time to get your vaccine. You can review the phases through the statewide plan on our website, covid.knoxcountytn.gov/vaccine-info. On that page, you can also utilize a new tool that the state has released to help inform folks when they will be eligible. Through that feature, you are able to opt in to receive updates and notification as Tennessee progresses through the phases. Now I want to move into our local situation. For our vaccination update, the Knox County Health Department continues to vaccinate those who fall into phase 1A1, 1A2, and those over 75 years old. To date, those who are 75 and older. To date, Knox County Health Department has received 4,700 doses and has administered, as of this morning, approximately 3,850 doses, with the rest scheduled to be administered this week and next. As a reminder, those numbers only include, again, the doses that KCHD has received and administered. On the case count side of the house, we have 371 new confirmed cases since yesterday's report. 4,634 of those are active cases. 178 Knox County residents are currently hospitalized. And sadly, we have 6 additional deaths to report today, raising our total to 359. And now we'll turn it towards the benchmarks. As of this, all of this data that we're going to talk about is also on our website. You can find it at covid.knoxcountytn.gov/case-count. Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and the growth rate over time. Over this time period, we saw an average of 285 cases per day, which is less than the average of nearly 400 cases per day in the previous reporting period. While we want to see the numbers continue to trend down, we are aware that this recent dip is likely to lower testing volumes over the holidays. Because of this, we are representing this benchmark as a cautious yellow. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. For this benchmark, we're utilizing two bar graphs, one that shows a sample of the tests conducted for Knox County residents and another for average time between specimen collection and lab report data. Regarding testing, over this time period, we did see a dip in testing. And again, this is likely due to the holiday season and was not unexpected. However, the total number of lab tests conducted for this time period still remains consistent with over 10,000 tests being conducted. Regarding lab turnaround time, this figure continues to decrease and is now at just over a 3-day average for the community as opposed to the 6-day average we reported last week. And because of these factors, we are representing this benchmark as yellow. Our third benchmark, sustained or increased public health capability. Of the cases that fall within the prioritization structure, the goal remains to initiate investigations for new cases within 24 hours of notification and close contact investigations within 48 hours. Based on our internal assessment of our capabilities and acknowledging the need to continue to prioritize our case investigations and contact tracing, as well as the need to support additional response operations, we are representing this benchmark as red. We want to remind everyone again, just like we do each week, to take personal responsibility and quarantine themselves at the first sign of exposure. Do not wait to receive a call from public health to start taking action. Isolate yourself if you have symptoms or have been exposed and start calling your close contacts to make them aware so they can begin quarantining. Additionally, if you've been tested, regardless of whether or not you have symptoms, you need to quarantine until you get your test results. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. These data are gathered from information hospitals put into the Tennessee Healthcare Resource Tracking System, or HERTS. It may reflect Knox County, East Region, or patients from other jurisdictions. During this time period, the number of COVID-19 inpatients, ICU patients, and ventilated patients hit all-time highs. This is exactly what we feared would happen after expected surges from the holidays. After speaking with our hospital partners, they have recommended this benchmark be represented as red. You'll see underneath the surge capacity chart that we have added a line that states that these numbers reflect the ability to surge related to space and equipment, but does not imply the ability to staff these additional beds. And this was done in an effort to provide increased clarity on the data. As always, the hospital systems continue to meet routinely, work together to ensure that no system is impacted disproportionately, and plan their response together to best serve this community. The decisions regarding how to classify this benchmark are made in concert with our hospital partners, as well as taking all of the data into consideration. Our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. For this benchmark, we use a graph that shows reported deaths of Knox County residents by date of death. Deaths have continued to increase in our community. During this time period, we have seen 64 deaths associated with COVID-19, and that is up from our update last week. This is an average of about 4.6 Knox County resident deaths per day. This information available leads us to represent this benchmark as red. Under our supplemental data section, the first chart shows new daily COVID cases per 100,000 population. As of Wednesday, our 14-day trend line shows 60 new cases per 100,000, and our 7-day trend line shows 61 new cases per 100,000. The second chart shows the percent positive for COVID-19. This data is received from the Tennessee Department of Health. The 7-day average for percent positive in Knox County is 24.05%. I'll now open it up for questions.
All right, as a reminder, please go ahead and submit your questions into the chat feature. From Jeff with WATE, when will you be able to accept new vaccine appointments? Will any more public events take place?
We will put out new vaccine appointments as soon as they become available. And we, again, have to have the vaccine, know we have it on hand to be able to do that. So as soon as we have the opportunity to do that, we will put it out. I don't have a firm date and time right now. And as far as public clinics, again, those will happen. We just, in the talking points at the beginning, we're going to be using a variety of methods to get vaccine out, with the goal to be is to get as much vaccine out as fast as we can. And that will include public clinics, but also continue to include appointments and closed pods.
From Alexandra with the Daily Beacon newspaper, have you worked with UTK on a COVID vaccine distribution plan? And if so, what does that plan entail?
We have not spoken to them as of yet about their plans. We talk to them all the time, but I'm looking at Dr. Buchanan. I don't think you've had a chat with them yet about vaccine distribution either. Again, we will be working at that and have some questions we still need to get answered.
From Scott with Compass, did last week's decision to include the 75 and older cohort to the categories of people to get vaccines take you by surprise? And if so, how much did that contribute to the difficulties people had in contacting KCHD?
It did in a way. We got very little advance notice of that decision that was being made, and had already planned our vaccine closed pods based on the allocation that we had received. And so we had to add in that group. And so that did pose challenge. And again, we wanted to be able to get the opportunity out there to that new group as quick as possible, which is why we made the decision to have the clinic on Saturday, as well as still reaching out to the folks in the other priority groups that we're vaccinating.
From Cole with WBIR, you spoke of a holiday surge hitting hospitals during the benchmark presentation. Do you expect it to continue to get worse?
Unfortunately, I do. We are probably at this point seeing some Christmas surge, and have not yet started, or maybe are at the very beginning of seeing New Year's surge. And this is just what we've seen throughout this pandemic of what happens following holidays and when people are getting together and celebrating these events. And again, it all goes back to please make good personal decisions about what your activities have to be as we continue to move through this. We need everybody to follow those 5 core actions all the time if we're going to try to slow this down.
From Jeff with WATE, you mentioned demand outpacing supply. What does the supply process look like? And then his questions, to be more specific, were when and how are you notified that more doses are coming in? And how many doses does KCHD get per week?
It's not a strict allocation per week at this point. We're hoping to get into a routine, but the way the process works right now is the state lets all of the health departments in the state know when more vaccines becoming available. We then say how much of that we think we can distribute, because you have to get it out during a short time frame typically, and then the state makes decisions based on how many, as Dr. Buchanan said earlier, how many hands are in the cookie jar, how many of us are asking for vaccine and how much we're asking for. Then they, based on how much they have available, distribute it following that. And that's when we get our final notice and can start making our plans.
From Cole with WBIR, is KCHD keeping a vaccine waiting list? If so, who qualifies?
We are not keeping a vaccine waiting list. We are pushing out vaccine availability and opportunities, but as of today, those that qualify are 1A1, 1A2, and those that are 75 years and older. And they just need to keep an eye on our website, on our social media platforms, to these briefings. We will be announcing opportunities as they become available and pushing it out every way that we can.
From Alexandra with the Daily Beacon, are vaccines available yet for food service workers?
They are not. Group 1A1, 1A2 are hospitals, healthcare workers, long-term care, first responders, and then those over 75 years old.
From Cole with WBIR, how confident are you that KCHD will receive a shipment of second doses of vaccines for the 4,000 folks that you've already given first doses?
That's a separate process, and we are confident that we will get those, and we will be scheduling separate second dose clinics for those that have received their first doses, and they'll be notified as those become available.
From Jeff with WATE, Has KCHD been able to use all of its shots? Have any of them spoiled?
No, we have not had any shots go to waste. And that is definitely priority one. We don't ever want that to happen.
Jeff says he asks because we've seen some communities rush and vaccinate whoever is available at the moment. What is KCHD's plan for that if it becomes necessary?
Yeah, that's our plan as well. The guidelines, again, that we've been given from federal government through the state on down is to not waste a dose of vaccine, not a single dose. And so if at the end of a clinic vaccine's available, we will work on contacting folks and vaccinating the folks that are there so that we don't waste that vaccine. That's a really good stepping stone to a point that we want to make is we are seeing a lot of folks that aren't showing up for our scheduled appointments. The appointments or closed pods when they've had times to come, it is imperative that you show up for those appointments because we don't want to waste vaccine and we want to keep it within the priority groups. And then if you've already gotten vaccine elsewhere, then please let us know so we can make sure to contact other groups to get them vaccinated that are still within those priority groups.
From Cole with WBIR, there were reports yesterday that the new COVID-19 variant had been detected in Chattanooga. Have you received any guidance from the state and has it been detected here?
Have not heard any words that it has been detected here. And I do know that the state of Tennessee overall is submitting specimens to CDC and participating in the to get those specimens typed to know where the different variants are. But you know, the guidance is, you know, it's the same that it would be. And so it's very important. Again, it just stresses the need to follow those 5 core actions all the time, staying apart, keeping at least 6 feet of distance, wearing a mask, not going anywhere if you're sick, washing your hands, all of those things continue to be very, very important. And especially if we have a variant that is in the area that is spread more efficiently.
From Vincent with Knox News, are the yellow traffic lights a statistical anomaly because they are being compared to the recent unprecedentedly high surge?
I don't know that. So the yellow traffic lights are in testing volume and turnaround time and in new cases. And again, we put that the new cases, we put that was cautious because we believe that likely just not as many people were getting tested. But the data that we had showed that they had trended down. And so that's why we made that a yellow, a cautious yellow. Our test turnaround time is improving and we're still maintaining above 10,000 tests a week. And we feel like that's a good place to sit. And that's where those were made. Those are separate from the hospital surge that we're seeing in the deaths as well.
From Jeff with WATE, which community partners are you working with in expanding vaccination access, and what would that look like when it does happen?
You know, I can't go into detail on that because it's not firmed up yet, and we don't want to get ahead of ourselves, but we'll release that as soon as we get the details firmed up. But it's really about getting additional opportunities throughout the community for people to be able to get vaccinated. So it's not just reliant on our capacity here.
Any further questions, please go ahead and submit them now. From Jeff with WATE, can you dispel a myth for us? Some folks seem to think there's a warehouse full of vaccine waiting, or just that the shots are just being dribbled out.
Yeah, there is absolutely not a warehouse waiting. This is all just logistics. Now, there was vaccine that had been set aside for the vaccination efforts in long-term care facilities, and that's going out now. But there is absolutely no hoarding or holding of vaccine. As soon as we're getting it and are logistically able to get it out, we're getting it out. And I feel confident that that's what everybody else in the state's doing as well.
All right, any further questions? From Claire with WUOT, with no waiting list, how do you find individuals to give leftover vaccine to people if people don't show up to appointments?
Well, at this point, we still have groups that are within 1A1 and 1A2 that we work with all the time that we're able to, and employers specifically is what, thank you, Dr. Buchanan, that have reached out to us. And that we've been working with throughout this. So that's really where we are at this point. That will likely change as we move forward, and we'll explain what that process looks like as well. But it's really about reaching out to the people we already have relationships with that we've been working with to get them scheduled in the future.
From Brian Hornback, has the Christmas surge happened yet?
I think we're starting to possibly see that. Like I said, a lot of people weren't getting tested though, so we're going to have to see what happens with our numbers over the next week or so. But I would expect that we're going to continue to see them to go up over that time period.
From Allie with the Sentinel, for people who are frustrated because they are eligible to be vaccinated, but doses aren't available, what would you say about the challenges KCHD is facing?
You know, I understand your frustration. And again, we just really ask for patience. It's a supply and demand situation. And so as soon as we get vaccine, we're getting it out to the best of our ability. And we encourage you to continue to keep an eye on our website and our social media platforms and watch here for us announcing future opportunities. But please just be patient. We will continue to get it out as fast as we can.
From Cole with WBIR, have you gotten this week's White House Task Force report yet? Any notable items with it?
I have not seen it come in before the briefing, at least today.
Any further questions? All right, I'm not seeing any other questions come in, so thank you all for your time. We will see you again for our briefing next week. We hope you have a good and safe weekend.